Question 1. A nurse is preparing to administer heparin intravenously. Which action is the highest priority? A. Assess bowel sounds. B. Verify the dose with another nurse. C. Encourage oral fluids. D. Check the client's temperature. Correct answer. B. Verify the dose with another nurse. Rationale. Heparin is a high-alert medication with a high risk for serious bleeding if given incorrectly. Independent double-checking helps prevent medication errors. Strategy. High-alert medications require extra safety checks. Question 2. A client receiving insulin becomes confused and diaphoretic. What should the nurse do first? A. Administer glucagon immediately. B. Check the blood glucose level. C. Encourage exercise. D. Give the next insulin dose. Correct answer. B. Check the blood glucose level. Rationale. Confusion and sweating suggest hypoglycemia. The nurse should assess blood glucose before intervening further. Strategy. Always assess first when hypoglycemia is suspected. Question 3. Which finding requires immediate intervention in a client receiving morphine? A. Respiratory rate of 8 per minute. B. Pain score of 4 out of 10. C. Blood pressure of 128/74 mmHg. D. Mild nausea. Correct answer. A. Respiratory rate of 8 per minute. Rationale. Morphine can cause respiratory depression. A respiratory rate below 12 per minute is concerning and requires immediate action. Strategy. Opioids can dangerously slow breathing. Question 4. A nurse should monitor which laboratory value closely in a client taking warfarin? A. Sodium. B. INR. C. Calcium. D. Glucose. Correct answer. B. INR. Rationale. INR evaluates the effectiveness and safety of warfarin therapy. Elevated INR increases bleeding risk. Strategy. Warfarin equals INR monitoring. Question 5. A nurse is administering potassium chloride 4. Which action is correct? A. Administer 4 push rapidly. B. Dilute before administration. C. Mix with insulin only. D. Infuse without a pump. Correct answer. B. Dilute before administration. Rationale. For potassium must always be diluted and infused slowly to prevent fatal cardiac arrhythmias. Strategy. Never give 4 potassium push. Question 6. A client receiving digoxin has a pulse rate of 54 per minute. What should the nurse do? A. Give the medication. B. Hold the medication. C. Double the dose. D. Encourage exercise. Correct answer. B. Hold the medication. Rationale. Digoxin can cause bradycardia. The medication should be withheld if the pulse is below 60 per minute. Strategy. Check pulse before digoxin. Question 7. A nurse should keep which medication readily available when administering fentanyl? A. Protamine sulfate. B. Naloxone. C. Vitamin K. D. Epinephrine. Correct answer. B. Naloxone. Rationale. Naloxone reverses opioid-induced respiratory depression. Strategy. Naloxone reverses opioids. Question 8. Which finding suggests toxicity in a client taking lithium? A. Tremors and confusion. B. Increased appetite. C. Dry mouth. D. Bradycardia. Correct answer. A. Tremors and confusion. Rationale. Lithium toxicity commonly causes neurological symptoms such as tremors and confusion. Strategy. Lithium toxicity affects the nervous system. Question 9. A nurse should question a prescription for enoxaparin in a client with A. Thrombocytopenia. B. Hypertension. C. Diabetes mellitus. D. Migraine headaches. Correct answer. A. Thrombocytopenia. Rationale. Low platelet levels increase the risk of severe bleeding with anticoagulants. Strategy. Low platelets plus anticoagulants equals bleeding danger. Question 10. A client receiving magnesium sulfate for preeclampsia should be monitored for A. Respiratory depression. B. Hyperactivity. C. Hypertension. D. Tachycardia. Correct answer. A. Respiratory depression. Rationale. Magnesium sulfate toxicity can depress respirations and reflexes. Strategy. Magnesium slows the nervous system. Question 11. A nurse is administering chemotherapy. Which PPE is essential? A. Sterile gloves only. B. Chemotherapy-rated gloves and gown. C. Surgical mask only. D. Eye shield only. Correct answer. B. Chemotherapy-rated gloves and gown. Rationale. Chemotherapy drugs are hazardous and require protective handling. Strategy. Protect both the patient and nurse from exposure. Question 12. A client taking phenytoin should be monitored for A. Gingival hyperplasia. B. Weight gain. C. Bradycardia. D. Diarrhea. Correct answer. A. Gingival hyperplasia. Rationale. Phenytoin commonly causes gum overgrowth. Strategy. Phenytoin affects the gums. Question 13. A nurse should monitor which assessment finding in a client receiving nitroprusside? A. Blood pressure. B. Hair growth. C. Appetite. D. Hearing ability. Correct answer. A. Blood pressure. Rationale. Nitroprusside is a potent antihypertensive that can rapidly lower blood pressure. Strategy. Continuous BP monitoring is essential. Question 14. A client receiving vancomycin develops flushing and hypotension during infusion. What should the nurse suspect? A. Red man syndrome. B. Hyperglycemia. C. Stroke. D. Asthma attack. Correct answer. A. Red man syndrome. Rationale. Rapid vancomycin infusion may cause flushing, hypotension, and rash known as red man syndrome. Strategy. Vancomycin should infuse slowly. Question 15. A nurse should assess which laboratory value before administering heparin. A. APTT. B. Hemoglobin A1C. C. Calcium. D. Bilirubin. Correct answer. A. APTT. Rationale. APTT evaluates the therapeutic effect of heparin. Strategy. Heparin equals APTT monitoring. Question 16. A client receiving regular insulin is scheduled for breakfast at 8 a.m. When should the nurse administer the insulin? A. Immediately after breakfast. B. At bedtime. C. About 30 minutes before breakfast. D. 2 hours after breakfast. Correct answer. C. About 30 minutes before breakfast. Rationale. Regular insulin begins working within 30 to 60 minutes, so it should be given before meals to prevent hyperglycemia. Strategy. Match insulin timing with meals. Question 17. A nurse is caring for a client receiving dobutamine. Which finding requires immediate reporting? A. Heart rate of 132 per minute. B. Mild headache. C. Temperature of 37 degrees Celsius. D. Increased appetite. Correct answer. A. Heart rate of 132 per minute. Rationale. Dobutamine can cause dangerous tachycardia and arrhythmias. Strategy. Cardiac stimulants can overstimulate the heart. Question 18. A client receiving alteplase should be monitored closely for A. Bleeding. B. Constipation. C. Hyperactivity. D. Weight gain. Correct answer. A. Bleeding. Rationale. Thrombolytics dissolve clots but significantly increase bleeding risk. Strategy. Clot-busting drugs can cause major bleeding. Question 19. Which antidote should the nurse prepare for a client experiencing toxicity from heparin? A. Naloxone. B. Protamine sulfate. C. Vitamin K. D. Flumazenol. Correct answer. B. Protamine sulfate. Rationale. Protamine sulfate reverses the effects of heparin. Strategy. Heparin antidote equals protamine sulfate. Question 20. A nurse should instruct a client taking warfarin to avoid A. Aspirin. B. Apples. C. Bread. D. Yogurt. Correct answer. A. Aspirin. Rationale. Aspirin increases bleeding risk when combined with warfarin. Strategy. Avoid extra blood thinners with warfarin. Question 21. A client receiving insulin suddenly becomes unconscious. Which medication should the nurse anticipate administering? A. Digoxin. B. Glucagon. C. Furosemide. D. Potassium chloride. Correct answer. B. Glucagon. Rationale. Glucagon raises blood glucose levels during severe hypoglycemia. Strategy. Severe low blood sugar equals glucagon. Question 22. A nurse should monitor urine output carefully in a client receiving gentamicin because of the risk for A. Nephrotoxicity. B. Hypertension. C. Hyperactivity. D. Weight gain. Correct answer. A. Nephrotoxicity. Rationale. Gentamicin can damage the kidneys. Reduced urine output may indicate toxicity. Strategy. Aminoglycosides affect kidneys. Question 23. A nurse should question a prescription for potassium chloride in a client with A. Hyperkalemia. B. Fever. C. Asthma. D. Migraine headaches. Correct answer. A. Hyperkalemia. Rationale. Giving potassium to a client with elevated potassium levels can cause fatal arrhythmias. Strategy. Too much potassium can stop the heart. Question 24. Which assessment finding is most concerning in a client receiving morphine? A. Oxygen saturation of 88%. B. Pain score of 3 out of 10. C. Mild drowsiness. D. Blood pressure of 120/70 mmHg. Correct answer. A. Oxygen saturation of 88%. Rationale. Low oxygen saturation may indicate respiratory depression from opioids. Strategy. Airway and breathing always come first. Question 25. A client taking tacrolimus is at increased risk for A. Infection. B. Hearing improvement. C. Weight loss. D. bradycardia. Correct answer. A. Infection. Rationale. Tacrolimus suppresses the immune system, increasing infection risk. Strategy. Immunosuppressants lower body defenses. Question 26. A nurse is administering epinephrine during anaphylaxis. Which assessment finding indicates effectiveness? A. Improved breathing. B. Increased rash. C. Bradycardia. D. Decreased urine output. Correct answer. A. Improved breathing. Rationale. Epinephrine opens airways and improves breathing during severe allergic reactions. Strategy. Epinephrine reverses airway swelling. Question 27. A client taking clonidine suddenly stops the medication. Which complication should the nurse monitor for? A. Rebound hypertension. B. Hypoglycemia. C. Constipation. D. Hearing loss. Correct answer. A. Rebound hypertension. Rationale. Abrupt withdrawal of clonidine may cause severe rebound hypertension. Strategy. Some BP medications must not be stopped suddenly. Question 28. A nurse should monitor which laboratory value in a client receiving vancomycin? A. Trough levels. B. Blood glucose. C. Calcium levels. D. INR. Correct answer. A. Trough levels. Rationale. Vancomycin trough levels help prevent toxicity while ensuring effectiveness. Strategy. Monitor drug levels for toxic medications. Question 29. A client receiving magnesium sulfate has absent deep tendon reflexes. What should the nurse do? A. Continue infusion. B. Stop the infusion. C. Increase the dose. D. Encourage ambulation. Correct answer. B. Stop the infusion. Rationale. Absent reflexes are an early sign of magnesium toxicity. Strategy. No reflexes equals magnesium toxicity warning. Question 30. Which instruction should the nurse include for a client taking methotrexate? A. Avoid alcohol intake. B. Increase sodium intake. C. Take with antacids. D. Stop laboratory monitoring. Correct answer. A. Avoid alcohol intake. Rationale. Methotrexate increases the risk of liver toxicity, which alcohol worsens. Strategy. Protect the liver during methotrexate therapy. Question 31. A client receiving nitroglycerin reports dizziness after administration. What is the nurse's best action? A. Assess blood pressure. B. Encourage running. C. Give caffeine. D. Restrict fluids. Correct answer. A. Assess blood pressure. Rationale. Nitroglycerin can cause hypotension leading to dizziness. Strategy. Nitroglycerin lowers blood pressure. Question 32. A nurse should monitor a client taking amiodarone for A. Pulmonary toxicity. B. Hair growth. C. Hyperactivity. D. Increased appetite. Correct answer. A. Pulmonary toxicity. Rationale. Amiodarone can cause serious lung damage. Strategy. Amiodarone affects the lungs. Question 33. Which finding indicates therapeutic effectiveness of naloxone? A. Increased respiratory rate. B. Decreased urine output. C. Bradycardia. D. Hyperglycemia. Correct answer. A. Increased respiratory rate. Rationale. Naloxone reverses opioid-induced respiratory depression. Strategy. Breathing improvement shows naloxone is working. Question 34. A nurse is preparing to administer insulin. Which action is most important? A. Verify the insulin type. B. Warm the medication. C. Shake vigorously. D. Give after meals only. Correct answer. A. Verify the insulin type. Rationale. Different insulin types have different onset and peak times. Medication errors can be dangerous. Strategy. Always verify insulin carefully. Question 35. A client receiving cisplatin should be monitored for A. Nephrotoxicity. B. Hyperactivity. C. Constipation. D. Weight gain. Correct answer. A. Nephrotoxicity. Rationale. Cisplatin is highly toxic to the kidneys. Strategy. Monitor kidney function with cisplatin. Question 36. A nurse is caring for a client receiving dopamine. Which finding indicates the medication is effective? A. Increased urine output. B. Decreased heart rate. C. Weight gain. D. Constipation. Correct answer. A. Increased urine output. Rationale. Dopamine improves cardiac output and renal perfusion at low to moderate doses, increasing urine output. Strategy. Dopamine supports heart and kidney perfusion. Question 37. A client receiving hydralazine reports headache and flushing. What should the nurse do? A. Reassure the client these are expected effects. B. Stop the medication immediately. C. Give insulin. D. Restrict fluids. Correct answer. A. Reassure the client these are expected effects. Rationale. Hydralazine commonly causes vasodilation-related side effects such as headache and flushing. Strategy. Vasodilators equals flushing and headache. Question 38. A nurse is monitoring a client receiving dobutamine. Which assessment is most important? A. Heart rhythm. B. Skin color. C. Bowel sounds. D. Reflexes. Correct answer. A. Heart rhythm. Rationale. Dobutamine increases cardiac contractility and can cause arrhythmias. Strategy. Monitor the heart closely. Question 39. A client receiving heparin develops black, tarry stools. What should the nurse suspect? A. Bleeding. B. Infection. C. Dehydration. D. Hyperglycemia. Correct answer. A. Bleeding. Rationale. Black tarry stools indicate gastrointestinal bleeding, a serious adverse effect of anticoagulants. Strategy. Anticoagulants increase bleeding risk. Question 40. A nurse should assess for ototoxicity in a client receiving furosemide. Which symptom indicates this complication? A. Hearing loss. B. Rash. C. Constipation. D. Weight gain. Correct answer. A. Hearing loss. Rationale. Loop diuretics can damage the inner ear, leading to hearing loss or tinnitus. Strategy. Loop diuretics affect ears. Question 41. A client taking lithium should be taught to maintain A. Low sodium diet. B. Normal salt and fluid intake. C. No fluid intake. D. High potassium diet only. Correct answer. B. Normal salt and fluid intake. Rationale. Low sodium can increase lithium levels and cause toxicity. Strategy. Lithium balance depends on sodium balance. Question 42. A nurse is administering epinephrine. Which finding is expected? A. Increased heart rate. B. Decreased blood pressure. C. Slow breathing. D. Hypothermia. Correct answer. A. Increased heart rate. Rationale. Epinephrine stimulates the sympathetic nervous system, increasing heart rate and blood pressure. Strategy. Epinephrine equals fight or flight. Question 43. A client receiving nitroglycerin reports severe headache. What is the nurse's best response? A. Reassure that this is a common side effect. B. Stop the medication. C. Give insulin. D. Increase dose. Correct answer. A. Reassure that this is a common side effect. Rationale. Headache is a common vasodilator effect of nitroglycerin. Strategy. Vasodilation equals headache. Question 44. A nurse should monitor which lab value in a client taking clopidogrel? A. Platelet function. B. Blood glucose. C. Calcium. D. Sodium. Correct answer. A. Platelet function. Rationale. Clopidogrel inhibits platelet aggregation, increasing bleeding risk. Strategy. Antiplatelets affect clotting. Question 45. A client receiving insulin is sweating and shaky. What is the first action? A. Give insulin. B. Check blood glucose. C. Restrict fluids. D. Encourage walking. Correct answer. B. Check blood glucose. Rationale. These are signs of hypoglycemia. Blood glucose must be checked first. Strategy. Always assess. Question 46. A nurse is caring for a client receiving magnesium sulfate. Which finding indicates toxicity? A. Loss of deep tendon reflexes. B. Increased appetite. C. Hypertension. D. Hyperactivity. Correct answer. A. Loss of deep tendon reflexes. Rationale. Loss of reflexes is an early sign of magnesium toxicity. Strategy. Magnesium slows neuromuscular activity. Question 47. A client receiving captopril should be taught to report A. Persistent dry cough. B. Increased appetite. C. Weight gain. D. Hearing loss. Correct answer. A. Persistent dry cough. Rationale. ACE inhibitors commonly cause a dry cough due to bradykinin buildup. Strategy. ACE inhibitors equals cough. Question 48. A nurse is administering naloxone. Which finding shows improvement? A. Improved breathing. B. Decreased urine output. C. Confusion. D. Bradycardia. Correct answer. A. Improved breathing. Rationale. Naloxone reverses opioid-induced respiratory depression. Strategy. Watch for breathing improvement. Question 49. A client receiving amiodarone should be monitored for A. Lung toxicity. B. Hair growth. C. Hyperactivity. D. Weight loss only. Correct answer. A. Lung toxicity. Rationale. Amiodarone can cause pulmonary fibrosis and toxicity. Strategy. Amiodarone affects lungs. Question 50. A nurse is administering alteplase. Which precaution is most important? A. Monitor for bleeding. B. Encourage exercise. C. Give antacids. D. Restrict oxygen. Correct answer. A. Monitor for bleeding. Rationale. Alteplase dissolves clots and greatly increases bleeding risk. Strategy. Thrombolytics equals bleeding precautions.